which is also known as the heart arrhythmia or cardiac dysrhythmia. Arrhythmias can occur when the electrical signals to the heart that coordinate heartbeats is not working properly. Some people may experience irregular heartbeat, which may feel like heart fluttering or racing. Many heart arrhythmias are harmless. However, if particularly abnormal or result from a weak or damaged heart, arrhythmias can cause serious or even potentially fatal symptoms. But with Adesan, as it is a potent vasodilator, stress agent, and antiarrhythmic agent, it gives utility in emergency and critical care. Adesan is an endogenous nucleoside that occurs in all cells of the body. When given intravenously, Adesan slows the AV nodal conduction that interrupts the entry pathways through AV node that can restore the normal sinus rhythm. That can restore the normal sinus rhythm in patients with paroxysmal supraventricular tachycardia, including paroxysmal supraventricular tachycardia involved Parkinson's White syndrome. It is antagonized by methylxanthines such as caffeine and theophylline that increases heart rate. More so, adenosine is rapidly cleared via cellular uptake, via endothelial and vascular cells with a half-life less than 10 seconds. In particular, adenosine is rapidly metabolized by phosphorylation to adenosine monophosphate by adenosine kinase or deamination to inosine by adenosine adenosine deamination kinase. Adesan is indicated in the conversion to sinus rhythm in patients with paroxysmal supraventricular tachycardia with including PSVT with accessory bypass tract. Adesan is a choice vasodilator, stress agent in myocardial perfusion imaging with a rapid onset of action in 1 to 2 minutes and returns to baseline 1 to 2 minutes after discontinuance. Adesan has a half-life less than 10 seconds and is direct coronary vasodilator compared to dipyridamole because dipyridamole is indirect vasodilator. Dipyridamole also is unpredictable that of adenosine in inducing increase of coronary blood flow. For our dosage in adenosine, in adult, we give initial dose of 6 mg rapid intravenous bolus followed with 20 ml normal saline flush. Then if no reversion to sinus rhythm within 1 to 2 minutes, we give the second dose 12 mg rapid intravenous bolus, then flush normal saline of 20 ml. The maximum dose of adenosine is 30 mg. While for our pediatric use, for infants, child, and adolescent, were equivalent to administered by weight. Pediatric dose in patients with body less than 50 mg, initial dose is 0.05 to 0.010 mg per kilogram as a rapid intravenous bolus either centrally or peripherally, then follow saline flush solution. For pediatric patients who require single intravenous doses less than 0.6 mg, adenosine injection may be further diluted with normal saline solution to a final 0.3 to 1 mg per kilogram. Patient with a body weight more than 50 kg, less than 50 kilogram, we may administer the adult dose. While for our myocardial perfusion imaging, Adesan is given as a continuous infusion at a rate of 0.14 mg per kilogram per minute over a 4-minute period. And maximum dose is 60 mg. Adesan has a higher sensitivity and specificity for identifying CAD or the coronary artery disease, compared to other pharmacologic stressors such as dipyridamole or dobutamine. For our fractional flow reserve dosage, administration of adenosine is injected at femoral, brachial, or radial artery at a dose of 140 microgram per kilogram per minute. Our adenosine is FDA Philippines registered, passed bioassay, CEDRES, evaluated and manufactured by SRS Pharmaceutical, a GMP certified IV drug manufacturer, with a price of 890 pesos only and used in majority of our major hospital nationwide. Once again, Doctor, thank you for your time and thank you for allowing me to introduce our adenosine Adesan. Thank you.